We are talking to Paul Collins, Program Director of the Child and Adolescent Treatment Services at Butler Hospital, about autism spectrum disorders. Paul has 20 years of experience working with children and families with these disorders. Paul, given your many years of experience in the field, can you shed some light on these disorders for families?
I'd be glad to.
Can you tell us exactly what are autism spectrum disorders?
Autism spectrum disorders are complex, brain-based disorders that usually begin appearing in the first few years of a child's life. Because they begin during those critical stages of child development, they're often referred to as developmental disabilities and may cause delays or problems in different skills from infancy through adulthood. Categories of autism spectrum disorders include autistic disorder, Asperger's syndrome, and pervasive developmental disorder. And each of these disorders, while having some commonalities, can have very different symptoms. Typically, they cause problems in the areas of social interaction and communication. Kids with autism spectrum disorders show difficulties in verbal and nonverbal communication, social interaction, as well as leisure or play activities.
What are some of the most common symptoms of autism spectrum disorder?
Well, autism is defined by a certain set of behaviors, and spectrum disorders refers to the degree to which each child is affected. One child may have very mild symptoms, while another may have much more serious symptoms. For example, in the area of social interaction, a child may fail to respond to his or her name. They may have poor eye contact or resist cuddling and holding or appear unaware of others' feelings. In the language area, a child might start talking later than other children. They may lose previously acquired ability to say words or sentences, and they may repeat words or phrases but really not understand how to use them. In the area of behavior, a child may perform repetitive movements such as rocking, spinning, or hand flapping. They may also develop specific routines or rituals. And they may be fascinated by the parts of an object, such as the spinning wheels of a toy car.
Do you know what causes these illnesses?
There is evidence that suggests the cause may be related to genetic factors or environmental factors. For example, viruses may also play a role in causing autism. Research is focusing on possible neurological, infectious, and metabolic factors as well.
How prevalent are autism spectrum disorders in children and adolescents?
Well, research methods can vary, and studies often show different results, which affects the numbers. Research suggests that the prevalence in the United States could be as high as 1 in 150 children, or 1 in 1,000 as a much more conservative estimate indicates. What we do know is that autism spectrum disorders occur in all races, ethnic groups, and social groups. They can affect any family and any child, although boys are 3 to 4 times more likely to be affected than girls. Another interesting statistic is families that have one child with an autism spectrum disorder also have a 2 to 8% higher likelihood that another sibling will have it too.
So if a parent suspects that their child might have an autism spectrum disorder, what should they do?
A parent should talk to their child's healthcare provider as soon as possible if they think something is wrong. Their pediatrician will listen to their concerns and will likely ask some other questions to determine the best course of action. They may also suggest further assessment and may refer the child to a child development specialist before deciding on a course of action.